Hello everyone. At the outset, I would like to thank the Andhra Pradesh Dental Council, my respected senior Dr. Satish Chandra Reddy, for giving me an opportunity to have this presentation on practice management at such a wonderful webinar series. I call this particular practice management as creation of entrepreneurs because we as dental practitioners should be the entrepreneurs in the real sense. This is what happens when you are into practice of dentistry and you are faced with difficulties, and then you go out looking out for the person who told you to join dentistry. So the BDS and also the MDS programs are designed and conducted for churning out dental surgeons. There is never an intent to create practitioners who should be actually the entrepreneurs. The well-known IIMs, Indian Institute of Managements, instruct their students in the art of negotiating the salaries and the perks as a final lesson in their business management. Last, there is no such thinking in any of the health related service sector. And at this point of juncture, I would like to appreciate the efforts of the Andhra Pradesh Dental Council in taking up this topic and understanding the importance of making the dental uh, clinicians or the practitioners aware about the importance of practice management so as the health of their practices will be more better. Most of us dream to be private practitioners. It is the window of the profession to the world outside. The conduct of the practice decides on how the world looks at our profession. So, when in practice, remember you are on stage and in limelight. You have to make your own rules and follow them. Private practice makes you feel like a king. So, let's understand how the management of clinical practice or individual practice or private practice is done. There are some basic elements of the practice. We have to first understand the treatment result should be of high quality, because unless we have high quality treatment results, it is definitely not going to sustain. So that is the main core of a successful practice. We must have pleasant atmosphere with high level of efficiency in our clinics. There has to be a positive experience. It has to be positive experience for the patient, doctor, as well as the staff. At the end of the day, first the patient should be satisfied, second the doctor who is treating should be satisfied, and the staff which is supporting us to do this treatment should be satisfied. So this work satisfaction is the most important thing in having this positive experience, which helps in building the practice. We should be using our time very efficiently, and remember that this is a team event, so our approach should be a team approach. Hence, our practice should be effective, efficient, and enriching. So, remember these three E's: effective, efficient, and enriching. And you have to always see to it that our efforts are automatically getting converted into good results, as given by James Allen, who was is a good writer. He suggests that E should be equal to R. That means efforts should be equal to results. If result should be more than the efforts, but it should never other way around. The effort should not be more than the results coming to us. So our basic target should be our effort should be equal to our results. We have to consider our dental practice as small business, and we should not shun away from this terminology of business. We have to understand that there is saturation in dentistry, and the businesses are usually affected by the quality of care, the staff attitude, efficiency of operations, overhead percentages, and compromising ethics in the pursuit of income. So even if there is saturation, we should not have any compromises in our ethics. The rationality and ethicality of the practice has to be always maintained in long run. That is the only thing which is going to give you success in your life. We have to understand what are the various stages of practice. I divided it into 4 stages. The first phase is what we can call it as the building phase, where our aim is to establish a sustaining dental practice. Second phase is the growth phase. After a few years into practice, the aim of the clinician is to increase the capacity, the number of inflow of patients to meet the demand. Third phase is the maturity phase, where the aim of the practitioner is to improve the efficiency and have better practice management. And the fourth phase is the final phase, where the aim of the practitioner is to concentrate on teaching or giving lectures at continuing dental educations, research, and other non-curricular aspect of the life. So we can divide the first building phase into 0 to 3 to 5 years, growth phase 5 to 10 years, maturity again 5 to 10 years, and the final phase of 5 years. So if you consider that the any person starts the practice at the age of 25 and practices till the age of 65, these 40 years have to be divided into these four phases. So every person can relate to these four phases and identify and work accordingly. And we have to understand why the businesses fail. First is lack of experience, then uncontrolled receivables, lack of good records, inventory turnover problems, and undercapitalization. So the lack of experience might be for the initial years of practice, but that will be taken care as you grow in practice. The receivables should be proper. There should not be any outstanding bills of the patient. For that, you need to have good records, which are in form of either electronic or paper records. And you have to understand that inventory turnover problem should not be there. I had a habit. I used to go for any conference, I find something new, I used to buy in bulk. But later on, when I used to have an inventory check, I used to make question myself that I have ordered these many things, but when I'm actually going to use it. So whenever you are ordering things, look where you are going to use it. So the inventory should not just get stacked up. It has to be properly having a turnover. And don't keep your dental practice undercapitalized. In every year, earmark some percentage of your profit which can be reinvested into your practice, so that the practice grows properly. And lack of sales, number of appointments or patient going down. So these are the things which we have to take care if you have to be a successful practitioner. So let's understand what are the various principles of practice management. For that, we have to understand 5 P's, practice management P's. First is the product, which is basically the service. Now this service include two things: the actual quality of the treatment and how you treat the patient. That means how you behave with the patient. So I always say that the patient don't remember the treatment given to them, but they remember how they were treated. So product is service, both the actual dental treatment and how you have behaved with the patient. Then the price, that is the fee structure. Place, that is your clinic or the office environment. Promotion, that is how's your visibility, actual visibility in society, in social media, everything. And how are your people, that is your dental team. So product, price, place, promotion, and people, these are the 5 important P's of or the principles of practice management. So let's go to the first key, that is the product. As we spoke early, the excellent quality of work, excellent quality of material, and excellent quality of service has to be there. You cannot run a successful practice if you don't have good quality of clinical work. So learning that is the most important thing. Then don't compromise in the materials, have excellent material, and also treat the patient. That means behave, the soft skills with the patient have to be excellent. For example, giving reminder calls for confirming appointments. It's a good practice so that the patient satisfaction index is high. Then follow phone calls after you do an important treatment or a lengthy treatment or a treatment which might lead to little pain or discomfort at a later stage. Then you can make a follow-up phone call and talk to the patient so that the patient understand that this particular clinic respects my suffering, and that is where the value of the practice goes up. Use lot of visual aids and patient education pamphlets. You can have welcome cards, or you can send or you can give a welcome letter when the patient comes to your clinic for the first time. It could be introduction of the staff, introduction of the doctor, introduction of the associate doctors, and the protocols which you follow in your clinic. You can show a small video also. On the procedures, you can have small videos or office pamphlets. And whenever a new patient comes, you can prepare an examination report card and give it to the patient and tell them that these are the various dental problems you have. So the patient also have an idea what are their problems, or this can be also sent by an electronic email or whatever it is possible. Then have good communication skill in case presentation. After attracting the patients to your office, you still need to educate them about their needs and answer their questions about the proposed treatment. We have to understand the number of patients who are coming to OPD are not important, but how many of them actually take the treatment, Dentistry is a procedural OPD. Number of patients just coming for consultation is not a good indicator. The conversion of OPD patient to treatment patient, that is the acceptance rate, should be higher, so that the number of people taking treatment will be higher, and that is the indicator for a good and a successful practice. What visual aids you can use? You can use clinical photographs so that the acceptance is better, videos or animations. You can have a 3D viewing which could be virtual, or you can have actual handling of materials like fixed partial dentures, or in orthodontics, let's say aligners or implants, whatever. You can actually keep some samples in your consultation area, and the patient can actually handle them. Then you can have modeling techniques. That means a patient who is doing the treatment or getting the treatment done, you can discuss with them, and you can make the new patient come in that particular area and see and actually talk with the patient. That is discussing and actually meeting with the other patient. I am an orthodontist, so I have this particular habit of making my orthognathic surgery patient meet the patients who have initially had orthognathic surgeries at our center, so that they, whatever questions they have, they can relate one to one in a more better way. So making the patient meet with the patient who have received the similar treatment is a very important aspect, and which will help the patient to accept the treatment. So for example, when you show a pre-treatment and a post-treatment photograph like this, they can actually relate to that particular clinical condition. So when you show cases like this, automatically the patient says, okay, I look something like this, so probably I will look how this particular patient is treated. So this is how you can make them understand. A picture speaks thousand words, that you have to understand. Now let's understand what the patient expects from the dental team. The patient wants the team to be on time, should be considerate, should be caring, should have empathy about the patient, not sympathy. It should be professional. The team should be interested in me, that means the patient. It should be non-threatening, friendly, respectful, and communicative. So these are the expectations the patient have from our dental team. There are some turn-offs of the patient in the dental office, so that we have to understand, so that we can keep them away from our clinic. Talking about the patient instead to the patient. Okay, uh, this is a very common habit. The doctor speaks about the condition of the patient to the fellow doctors or the fellow staff members. No, talk to the patient. Then ignoring a patient who is standing at the reception desk. This is a very important thing which you have to tell your reception, is that whenever any new person comes, she has to leave whatever work she is doing, welcome the patient, request them to wait for a while till she completes the work in her or his hand. Then failing to remember that most patient can see and hear, and very important thing is talking about improper cleaning, improper sterilization. If any instrument falls down, trying to pick it up. If the patient is not speaking, but you have to remember the patients are listening and the patients are seeing, remember that. Then criticizing other members of the team or other patients or other professionals, never ever do that. Patients don't come to your clinic to listen to the gossips. Then failing to answer the telephone by the third or the fourth ring, which is very important. The receptionist who's going to receive the telephone has to be trained to receive the calls as early as possible. Not knowing a patient's name when he or she enters or arrives, or misspelling a patient's name on the statement, is a very wrong thing to do. Then failing to inform before you perform a clinical procedure. Always inform the patient before you perform the clinical procedure. Then sending mixed signals about fees and payment options. We'll talk about fees and payment option that time. I'll take this in detail. Then patient satisfaction. For a patient satisfaction, as I said, the patient service should be good. There has to be a satisfactory relationship management with the patient. The communication with the patient, your as well as the staff of the clinic, has to be good. We have to always evaluate, keep on evaluating what is the patient satisfaction index in our clinic. You should handle the patient's complaints very efficiently. Whenever any patient complains about something, he or she should be felt that my complaint was addressed and it was solved. Remember, rather than the positive testimonials and hunky dory and appreciative remarks or the feedbacks of the patient, I will always give more important to one bad feedback given by a patient, so that I can improve upon it. Okay, because you should always give respect, and you should read the bad feedbacks more carefully, and they are more helpful, because many of your patients are going to be happy. So it's like, satisfying your ego reading those uh, feedbacks. But always concentrate on bad feedbacks. They are the important parameters for improvement. And remember, our business grows through patients. Mouth to mouth publicity of the doctor is the biggest way the practice can grow. So we get our business through the patient. So satisfying the patient is the most important key. Second thing is the price. The professional fee which we charge to the patient. So the professional fee charged by the dentist, which is actually sometimes for the patient not always the most important consideration. They don't mind paying a high price if they receive proper treatment by the doctor. But we have to understand that we have to think about the productivity, which includes costing and pricing for profit. What is the return on investment, or return on investment we can call it as we discuss, ensuring the results, efforts equal to results. And you have to always keep on thinking, how can I give more without losing money? There are many avenues where you don't have to actually spend, but there are ways where you can improve your rendering of services. You have to understand, practice expenditure is based on some of the fixed expenses which are constant and periodic, independent of the production. Variable expenses, they increase as your production increases, which includes materials and supplies and laboratory charges. And there are some discretionary expenses which can be fixed or variable, like giving a gift at the end of the treatment to the patient. They enhance productivity, but production is still possible without them, and they may help facilitate the delivery and the quality of the dental care. And when you can say that I have break even my clinical practice, is where your fixed costs and variable cost, whatever is the cost, the total of this, that much is your receivable. So that is where you have break even, and whatever you earn beyond that is your profit. And you must have a good financial administration. You must understand the monetary aspect. You should always plan how to set and collect the fees. Develop proper financial support system, which involves understanding of the financial statements, fee setting, and the hourly cost, the cash flow, the collection policies. Fees, that is the most important point which dentists worry about. Set fees appropriate to your unique practice requirements and based on your own cost of doing business. Should be based on time, for which you must have the knowledge of hourly expense rate, what is your expertise in the field, and what is your perceived competitive positioning. The higher the competitive positioning, the fees goes higher. And when you are making your fees higher and higher, it indicates that you are slowly going up in the ladder of the practice hierarchy. You must increase your fees, and it should reflect changing the practice numbers. As a stage come where you can manage the number of patients become more and more, that is the time probably you have to think of having a fee increase. And fee changes should be made based on the financial data. Don't do it erratically. There has to be directness when you're talking about the fees to the patient. Don't have any haphazard statements. The patient should have ease of understanding the fees, what is for what. They have to be brief. Don't keep on discussing about fees all the time. That is where the patient starts negotiating and getting away. So just mention about the fees, explain it in one go, that's all. And review your policies every 6 months based on what is your total production, total collection, change in accounts, what are the receivables. Think about what are the various payment methods the patient can use. There are some tips about payment. First, as I said, explain fees openly. There has to be an effective communication about the fees with the patient by the treating doctor. That involves a lot of confidence in the patient's mind. Develop and use a written fee schedule. Keep a carbon copy or keep a copy with you so there are no disputes at a later stage. That gives a very bad taste. Develop written treatment plans. Write a treatment plan, tell them for this particular treatment plan, these are my fees. So if there is any alteration in the treatment plan, that can be compensated for. Collect the deductibles and the small fees at the time of probably initial or the consultation appointment. And whatever payment plan you have decided, follow those plans carefully and meticulously. This payment plan could be all the payment coming to you in advance, or one half in advance and the remaining half at the whatever is the final visit of the total treatment appointments you have scheduled. This applies to all branches of dentistry. Or you can have one third at the start, one third during the treatment, and one third at the final visit. Or you can have equal payments at all the visits, or you can have a customized plan for the patient, and the mode of payment could be cash, check, credit card, whatever suits you. Or you can new modes, like probably in future we'll be having insurances and the company payments coming to us. The third thing is the place, that is the clinic per se, the office, the environment of the office. It conveys an image and a message. It should be high tech, at the same time it should be homely. The patient should not feel that he has got, he's lost there. He should feel homely. It should be immaculately clean. That's very important. It should contain modern equipments. It should convey a sense of personal warmth to the patient. There are some suggestions. Have a good proper clinic interior planning. Design it properly from the utility point of view, ergonomics point of view. Beautification is endless. These utility and ergonomics is more important. Beautification you can keep on adding. Use instruments and materials which require less chairside time, so that you can see more number of patients in one appointment. Then coming to the timing. So when you're talking about the place, it is the cleanliness, the clinic design, then how the appointments or the workflow happens. So in the workflow, most important is the appointment control. The scheduling of the appointment should be based on the size of the patient pool, type of dentistry performed, style and philosophy of the dentist, staffing consideration, office facilities and equipment. Have a proper appointment book, or you can have online appointment, but pre-schedule and give reminders to the patient. If possible, delegate the work, hire staff accordingly, train the chairside assistants to minor clinical work by training the unskilled, hire dental surgeons to assist you and do a supervised delegation, hire specialists if workload is high. You can make your chairside assistant undergo courses like dental operatory assistant courses, so that they will be useful for you. Then you can hire specialists if the workload is high. Try to schedule in such a way that the clinical work should go on even in your absence. Spend maximum time, where the main clinician should spend maximum time, consultation and planning the treatment. So you must spend more time in consultation and treatment planning appointments for maximum conversion rate of your OPD patient to those patients who accept your treatment. Diagnosis and planning the treatment, that is where the maximum brainstorming needs to be done. Doing the most critical step in the treatment, which are important from the quality output point of view. Incorporating important treatment adjuncts, and those procedures which are not falling into these categories, you can delegate the procedures. For example, prophylaxis, follow-ups, etc. you can delegate. The appointment should be based on hours of operation, days of week, scheduling the protocol, completing one full day appointment before opening the next day appointments. Because why not to work 2 to 3 days in a week fully, rather than 4 to 5 half days. The remaining days you can use it for your own good. Must have a good appointment book, or you can have an online appointment system. But in the online appointment system, the patient gets the choice of scheduling, which may affect the workflow. So but it gives a reminders also to all the appointments, and sometimes it is difficult. We give reminders to appointments which are beyond 30 minutes and more. Value your time, calculate your productive time. For example, total available working days are 365. Non-productive days, Sundays, national holidays, illness, because of inclement of the weather, continuing dental education, you have gone for a conference, suppose you take a vacation, other days. So the total working days become 365 minus these 100 days, so 265 working days. Suppose you work 8 hours per day. Productive hours excluding your preparation time, lunch time, closing time, 1.5 hour goes in that, so 6.5 hours every day. So 265 multiplied by 6.5, 1700 hours are the productive hours in 1 year. So the value of your 1 hour is whatever is your total income of the year divided by 1700, and that's the value of your 1 hour. So and now this is about the patient flow, and then now actually coming to the service, giving reminder call, follow phone call, using visual aids, which we have discussed initially. These are very important things. Also choosing the right laboratory for good quality, variety of services, service needs, education, ethical consideration, cost, and work schedule. So when you are choosing the laboratory which supports your clinical practice, think of these things so that it will be a fruitful synergistic growth. Then promotion. You must have good visibility. Does the community know that your practice exists? Use good signages. It can be external, as I said, with the help of signages. It can be by internal, that is by the current patients who are coming to you. So it's patient to patient. Then online. In today's context, having online or digital presence is very important. So have your own website or use mobile application. Use social networking sites which are very important. Just Dial, Practo, etc. Various sites are there. You can use them. Branding, I feel that rather than having a fancy name to the clinic, the name of the doctor should be used, because finally the doctor is the brand in the clinic. People should not say that I have got the treatment done in this clinic, forgetting the name of the doctor. I will always prefer patient remember my name and they say yes, we have got treatment done from this doctor. Okay. Then marketing your activities. There are these 6 steps which are important. Create an identity, build patient relationship, connect with your community, utilize the media, utilize the technology, and make the product more tangible. And the last thing, that is the people, refers to the entire dental team, takes the total involvement and commitment of the entire dental team. You cannot win tournaments if you don't have a good team. Only a captain performing doesn't work. That's the reason you must have the whole team performing for you. So coming to the staff management, have excellent managerial practices. Read about a lot of human resource management, how they are done. Motivate the staff, try to retain the staff. It is very good for even the patient retention. Like a patient comes to you after 5 years for some different work, and when they enter the clinic they see the same staff member, they can relate very nicely, and they understand that any establishment which retains long term staff must be really doing good. Okay. The staffing should be based on educational background, past employment experience, training and experience in dentistry, unique talents, abilities or training that would be useful in the new position. You need to keep on training your staff. You have a good uniform for them, have a fixed payday for them. Usually have staff meeting once in a month, or as per the requirement they motivate your staff. Pay raise should be based upon the amount and training, how much that staff is giving, taking interest in the clinic and the duties what he is or she is doing. Efficiency of the person, how they are groomed and how is their appearance. Promptness, dependability, individual value to the clinic. Have a proper schedule or policies about the leave. Have clinic get-togethers. That's very important. You can have a dabba party once in a month. Terminate the employees which are not doing properly. You must do it immediately. And coming to the management of the self, that is very important, because apart from the practice management, you managing yourself is the most important. Your personality should be designed properly. Have self-confidence. Modify yourself. Develop personal power. You must be pleasant and friendly. Some people are born with it, or you need to achieve it if you are not that way. You must look approachable. You must have a confident body language, speech modulation, good habits, good posture, and good gait. All these things should inspire a sense of awe in those who behold you. Aim high. After all, you are the stars of the film called Dentistry. Manage your time properly, respect your own time, decide the priorities in your life, learn to say no in a friendly manner, decide your weekly off, take vacations, learn and read something new every time, give quality time to your family, spare time for yourself, for hobbies, for exercise, for recreation, for social networking. Have institutional attachment simultaneously along with your clinical practice. It improves your social circle. You can take jobs which could be institutional jobs or private jobs. Be in touch with academics, be in touch with research, learn about computer application and clinical photography. Attend the continuing dental education courses or hands-on courses, self-learning courses. Must do unlearning and relearning. Be associated with the professional organizations such as IDA, IOS, ADA, AO, DCI, etc. Attend conferences, attend or if possible present. Involve in spreading awareness about our profession. Remember this, that think always that I have to be better than yesterday's myself. And I just at the end would like to share the International Business Daily's 10 secrets to success. How you think is everything. Decide upon your dreams and goals. Take action. Never stop learning. Be persistent and work hard. Learn to analyze the details. Focus on your team, time, and money. Don't be afraid to innovate. Be different. Deal and communicate with people effectively. Be honest and dependable. Remember, no one can motivate you until you motivate yourself. I would like to just end with this slide or with this particular example. Breaking of egg can be seen in two different ways. When you break the egg from outside, there's destruction of life. But the same egg, when breaks open from inside out, there is creation of life. So similarly, you must have your internal motivation. Shoot for the moon. Even if you miss, you will land among the stars. Happy dreaming. All the best. Wishing you tons of success in your clinical practice. Thank you very much.